So, drug-induced schizophrenia, there are dozens of psychiatric drugs that can produce full-blown symptoms of schizophrenia in certain persons. It is important to determine if the onset of mental illness occurred soon after starting medication. I've encountered occasional patients diagnosed with paranoid schizophrenia who were faithfully continuing a medication that caused their illness. In these cases, complete recovery may result from simply weaning the patient from the medication. I've met other heavily sedated patients who were unnecessarily taking an atypical antipsychotic drug after a single psychotic episode that apparently was caused by a suspect medication or recreational drug. Illegal drugs of abuse, including cocaine, LSD, PCP, and amphetamines, can produce a side effect of psychosis in highly sensitive persons. In rare occasions, a psychosis condition can be solely the result of continuing the drug abuse. Most drug abusers deny their use of illegal drugs, and this condition can be very difficult to diagnose. Urine testing for illegal drugs is very inefficient, but radioimmunoassay of hair tests can determine the nature and the frequency of drug abuse. Most patients with drug-induced schizophrenia that persist after abstinence exhibit undermethylation biotype. Pretty interesting, huh? I'm reading this book called Nutrient Power. Really like this book. It's by Dr. William Walsh, PhD. And the subtitle of the book says Heal Your Biochemistry and Heal Your Brain. Very, very interesting. And this, in this book, represents a huge amount of studies done in regards to mental disease, sometimes inherited or acquired, and therapies to help live a better life. To even lots of times people become cured after doing these therapies. But this is very, very underground. This is not mainstream at all. Okay, so I'm not going to talk too much about a lot of these what's in this book today, but it does. I mean, just looking here at the back, talks about ADHD, Alzheimer's, autism, depression, anxiety, bipolar disorder, schizophrenia, and so forth. But the purpose of these lectures is also to tell you, show you guys some resources that I use, things I like to read, to help us do what we do today. So today I'm going to start lightly talking about micronutrients. Micronutrients are huge. Inside your body, you don't have receptors for Tylenol, ibuprofen, prednisone, corticosteroids. You don't have those receptors inside your body. You have receptors for B12, you have receptors for zinc, you have receptors for copper, you have receptors for a slew of different things. Now, as we were seeing here, there's actually episodes where people will get schizophrenia, acquire schizophrenia due to other drugs they are using, legal or illegal. And before I dive into it, next time maybe you see a homeless person on the street, sometimes we're very quick to tell the person, hey, get a job, or think, or I'm not saying to give money or not give money to the person. I particularly, in rare occasions, I will. If I feel really moved and I see that it is a situation of, the person needs some financial assistance there momentarily for some food or so forth. But I prefer to help in other ways, and that's something that we do at the clinic. When possible, and we find the right people, we like to donate some treatments to help the person improve their life, maybe their brain or their physiology, their body. But it's really interesting for us to think about, our population and the homeless population. A lot of them are suffering from things that they have induced on themselves due to their lifestyle. And it's crazy how once you read these things, once you actually delve into deep study into the area of micronutrients, we can actually start to see that there's hope for these people. But the thing is, there's no information out there. And without information, how do we get this across to people? So what am I really talking about? And I keep mentioning this word micronutrients. So micronutrients are anything like your vitamins, your minerals, your antioxidants, and I'll give you some examples of some of your vitamins. For example, your B complex, B1, B2, B3, B4, etc. Those are your B vitamins, right? But then you have your minerals, like manganese, zinc, copper, magnesium. Those are minerals, right? And minerals are wonderful for you and not so much spoken of. And very important, they're really touched upon on this book and many other books of the sort. And then you have your antioxidants like vitamin E, which is an antioxidant, glutathione and acetylcysteine. Those are also antioxidants. And then you have your amino acids like serine, asparagine, arginine, lysine, and so on and so forth. Now, it fascinates me many times to hear or read articles saying that these things can be harmful for you, etc. And yes, there's cases where over usage of certain vitamins, etc., can be a little bit more dangerous for us. But for the most part, the body recognizes what we're putting inside of it. So the body will recognize what is B12, right? It's very difficult, if near impossible, to have a vitamin B12 overdose, and I particularly have never heard of one. Given that there's B12 being sold all over the place. There's B12 being sold in energy drinks. Not that I'm supporting energy drinks here, guys. I don't support any kind of stimulants, caffeine, or any of that. But you should have your own energy, and go watch our lecture on energy about that. But there's B12 being sold all over the place. There's B12 in IVs, etc. Nowadays you can pretty much walk. I'm in downtown Miami. You can find an IV shop almost anywhere. And there's B12 inside of those and so on and so forth. So B12 not something we would worry much about. And it's interesting that B12 also gets stored in the body. It takes about 4 years to deplete the stores of B12. Somebody, for example, will go through bariatric surgery, and only about 4 years later, so you'll start to see actually that macrocytic anemia kick in. And macrocytic meaning the red blood cell gets really big, and it's characteristic to vitamin B12 or vitamin B9 deficiency, which is folate. So what am I trying to tell you guys? I mean, there is so much necessity inside our body for vitamins, minerals, antioxidants, nutrients inside your body. Okay, there's a bunch of receptors for micronutrients in your biochemical pathways. There's no receptors, like I said, for Tylenol. There's no receptors for the medications that we're using. So in certain people, you're going to see certain pathologies or diseases manifest when there is imbalance in some of these vitamins, minerals, antioxidants, and so on and so forth. For example, what is the biochemistry of anxiety? What is anxiety? I, for one, when I went to medical school, nobody ever taught me what was the biochemistry of anxiety or depression, for that matter. You see, there's no tangible calculation to say, okay, past this threshold, it's anxiety, or under this, no. Or same thing for depression. Depression is usually diagnosed with a mnemonic called SIGI CAPS, which if you went to traditional medical school, most people will know this, which is sleep disturbance, lack of interest, guilt, concentration issues, appetite disturbance, psychomotor retardation, and then suicidal ideation, which obviously, if anybody has an increased tendency to this, or whatever, and anything in regards to that person needs immediate attention. But needless to say, there is no biochemical pathway that is taught to us, no actual calculation. And when I keep saying calculation, I mean, like, for example, if a person's ejection fraction is low, right? If they have an ejection fraction, which is of the heart, right, of 51, 50, or whatever, that means that person's having heart failure, right? Or if somebody hurt their meniscus, well, that person, hurt their meniscus, and you can see it on an MRI. But as it relates to many of our psychiatric disorders, that's not how it works. There's no actual verifiable data behind that. And many or all of the information in the Bible of psychiatry, and when I say Bible, I mean the textbook, which is DSM-5, the Diagnostic Statistic Manual of Psychiatry. To my understanding, all of it, if not most of it, is voted by psychiatrists to understand what that disease is. They actually vote, and with those votes, they actually vote in, okay, the anxiety is this, this, and this. It's this compilation of symptoms and should be treated this way and that way. So I would like to advocate for the world to look at mental disease and even look at our physical body. And I'm recording this off the top of my head, but for some reason I'm going more towards on psychiatry today because I picked up this book. This was a book that I saw and I started talking about this. But it also relates to your physical performance, to the quality of your skin, the quality of your hair. And I'm going to give you guys today a few examples on certain micronutrients that are very, very important for you. And today's going to be a lighter lecture on micronutrients, and then we'll have a deeper one, right? So, and keep in mind, saying the word, before I get a little deeper, when you say the word micronutrients, then you think, well, what's macronutrients, right? And for those of you that don't know, macronutrients are proteins, carbs, carbohydrates, and fats. There's one more, but you don't really eat it, right? It's DNA. DNA is also considered a macronutrient, right? So, micronutrients, I'll start with one of my favorite ones, which is magnesium. Magnesium is super important, right? There's about 12 different types of magnesium. So magnesium sulfate, citrate, biglycinate, threonate, and so on and so forth. Each one tends to be better at certain actions than the other, right? But magnesium is wonderful in many regards, and I'll give you examples. For example, a child that's born prematurely is required to give magnesium to that child if he's born before those 32 weeks gestation, right? Because it's important for the development of the brain of the child, right? And in other lectures, I've spoken of protocols that moms can do to increase that child's IQ and prevent issues with that child at birth, right? There's another lecture that I talk about environmental toxins, and I mentioned that there's more than 200 toxic chemicals that are found inside the umbilical cords of babies that are just born, not newborns, just born. They're born right there and they collect blood and they see that there are more than 200 chemicals that are toxic, the environmental chemicals that are toxic inside those babies already, right? So I'd like to think that many of the diseases that are occurring nowadays that we see in children or lower levels of IQ, ADHD, etc., is maybe it is connected to a lot of these toxins. Maybe it is connected to things that we're eating. Maybe it is connected to Red 40 and MSGs and so on and so forth, right? So once giving magnesium to the child helps that child's brain development, also helps adults in many different ways. And any traditional doctor will know, for example, if you take an alcoholic person from the streets, right, and they need to be medicated urgently and they're in the emergency department, and you give them a banana bag, as we call it in the hospital, and they're receiving that IV, but you see that it's nothing's actually moving. You bring back their blood, and nothing's moving. The sodium, potassium, all that stuff is still stuck. Well, then you check magnesium, and magnesium oftentimes will be, if not every time, will be the culprit, which is too low. So hypomagnesemia won't allow for other vitamins, minerals, nutrients to move for the most part, and another great thing about magnesium helps you actually to poop. Magnesium helps you to go to the bathroom, especially biglycinate. Biglycinate's a really good form of magnesium that really helps you to go to the bathroom and move your bowels. So a lot of people taking a lot of different medications to use the restroom should consider magnesium. And there's actually an old functional medicine joke that you say, hey, you want to know the right dose of magnesium to give somebody? Well, give them enough until they have diarrhea and just take off a capsule. Obviously, it's a joke, but kind of a cool rule of thumb, given that magnesium will immediately loosen your bowels. So for those of you out there that are, a little constipated or sometimes struggle depending on what you eat with your diet, maybe use the magnesium. Obviously, look at your diet, consider fixing your diet, but also you can piggyback a little bit on the magnesium. Another thing that's really interesting about magnesium helps to lower blood pressure. Magnesium is a wonderful agent, helping the heart, circulation, etc. And a side effect of too much magnesium is lowered blood pressure. Okay, so um, when if you take too much, it could be actually dangerous for certain people. But not there's not many reported cases that I know of that where magnesium was taken too much, and all of a sudden the person, had some issues with hypotension, etc. Um, and something else that's really good about magnesium is it's really, really good to prevent arrhythmias, right? So people that have issues with their heart going into different types of arrhythmias, like for example, AFib and so forth, magnesium is very, very interesting and helpful for that, right? That's one of my favorite all-time minerals. I take about a gram a day, so I'm actually right at that point. I can't take too much more than that because it then loosens my bowels. But I feel really, really good with it. I don't drink caffeine, um, but I use it to sleep, and in the morning I actually use it in the morning. So, like I said, I don't drink caffeine, so that's kind of my substitute for a cup of coffee. Wait, but does it give you energy? No, it doesn't give me energy at all. But it just gets me zeroed in and focused, right, and calm. And some days I'll also take GABA with the magnesium in the morning because I know I need a little bit of GABA, right? Like I always recommend, do your own testing and figure out what your body needs. But magnesium, very, very important. Hard to measure. 99% of the magnesium it lives within your bones. So blood tests and so forth tend not to be too accurate on that. And then it's very important for you to see the intracellular health of your body with magnesium. Okay. And see, we've spoken about magnesium now for a few minutes, and that's just one little mineral. And I barely have said anything about magnesium and how wonderful it is. Okay. So there you go. You have some pearls for mental health, for circulatory health, for your gut health. Magnesium is wonderful and imperative for you. And if you're going to consider supplementation with vitamins and minerals and so forth, and you're not taking magnesium, it's like oof, you really got to be taking the magnesium. Another one that I really like to talk about is vitamin D. Vitamin D, very, very important. So really important that you get on a vitamin D regimen. And honestly, I don't think it should be called vitamin D. It should be called hormone D because it's synthesized from cholesterol. So what does cholesterol have anything to do with this? So if you guys go see our other lecture on hormones, cholesterol, steroid hormones, which, for example, would be estrogen, testosterone, progesterone, aldosterone, pregnenolone, they all come from cholesterol. And vitamin D is there as well, and it acts like a hormone too. So vitamin D3, super, super important. Now, a lot of times you guys will see people taking vitamin D3, but they complain that it's not going up. And then we do their blood exams, and that vitamin D3 has not even moved nothing, not even a nudge. So what does that mean? They're usually lacking cofactors. So they'll be lacking something like vitamin K2. So vitamin K2 is very, very interesting and was discovered by Dr. Weston Price, which was a dentist that traveled the world studying what these people had, these indigenous people. He went around studying the world in indigenous communities to understand how their dental health really functioned and the foods that they ate and why they didn't have so many dental problems as we do in more industrialized populations. So he found something which he called factor X, or activator X as he would call it, and was only really in the year, I believe, 2007 that they coined the term, they coined this as vitamin K2. You know how you have vitamin B1, B2, B3, and all the way up, vitamin B17, vitamin B18, look those up. That's a conversation for another day, but there's more than just B12. Same thing with vitamin K2. So there's vitamin K1, which is virtually very difficult for there to be any nutrient deficiencies as it relates to vitamin K1. It is possible. And vitamin K1 indeed has to do with clotting factors and so forth. And you have to be careful with that if you're on anticoagulant like warfarin and things like that. But vitamin K2, completely different story, right? Again, if you're on anticoagulant and so forth, and you're considering taking vitamin Ks, and most namely K2, talk to your physician about this because it is a more serious topic. But Vitamin K2 is very different as it relates to vitamin K1. Now, vitamin K2 is very protective towards your heart. Vitamin K2, especially, I mean, that's just such a lifesaver, vitamin K2. Vitamin K2, basically what she does, so vitamin D pulls the calcium from your gut, okay? Vitamin D is pulling the calcium from your gut, and now vitamin K2 is directing the calcium where to go in your body. So basically, vitamin K2 is saying, hey, calcium, go into the bones, go into the teeth, okay? But also, vitamin K2 is helping to remove plaque from your heart. It's helping to, with that big topic which plagues our country, which is called atherosclerosis. So, meaning the hardening of those arteries due to calcium deposits. That's why there's many articles online that just supplementing with calcium alone can increase your chances of heart disease. I've seen even some studies saying 600 times, okay, depending on how that calcium supplementation is done. Okay, don't take my word for it. You can go ahead and pause this and go to Google Scholar and put calcium supplementation alone, increased risk of heart disease, right? And again, go to googlescholar.com so you can see all the articles populate, okay? Try to avoid only google.com to search for studies. Consider googlescholar.com always. And you'll have international studies too, because sometimes people only want to read what's produced here in scientific community in the US, but I like to see what everybody's doing worldwide, right? And I respect everybody and their scientific studies and visions, right? So vitamin K2 is essential to help direct calcium in the body. It's essential to direct calcium to the right places and remove them from the wrong places. Now, what's interesting is heart disease depends on calcium. All right, calcium and poor fats, etc. I'm not going to talk about cholesterol today. You guys could go watch another funny, another lecture I did on. See, we don't stop the camera here. We keep going. Okay, we want it raw, we want it authentic, and that just makes it a lot better. Okay, so you guys could go see another lecture that I did on cholesterol. But so now the calcium, when it deposits inside that vessel, for example, where you get carotid stenosis. Four vessels you really want to be careful with is the carotids, the coronaries, the aorta, and the popliteal, which is behind the knee. That's the one that diabetics have a lot of issues with, and unfortunately sometimes they have to have their legs amputated. But for example, the carotid artery, which sometimes only, not sometimes, by guideline, you only address this, and I think this is crazy to me. When there's 70% occlusion, that means it's blocked by 70%, okay, so tiny, with symptoms, or 80% with no symptoms, and you would catch it on an ultrasound. So 80% with no symptoms, that's barely any blood that's going by to your head, right? So we don't want to suffer from that. And yes, that's in mainstream medicine. That's in our board exams. That was in one of my board exams. Had a question on that. And hopefully I got it right. No, I'm kidding. But yeah, those are the guidelines. So point is, we don't want that kind of framework, that mindset being applied to us. If you're listening to this, you probably are being a little bit more proactive. You want to understand how your health works, etc. So when you see that kind of atherosclerosis building up, when you see heart disease, there's usually another good friend that's with that, another good friend, but bad guy to us, that's walking right alongside heart disease. And you know who that is? Osteoporosis. So osteoporosis and heart disease like to go together. Well, why is that? Remember, the calcium is being displaced. America and the world suffers from displaced calcium. Huge problem. Calcium leaving the bones, leaving the teeth, and going to the wrong places, inside the vessels, inside our hearts, etc., and plaguing us with atherosclerotic disease. Some people say, some clinicians in my field will say that atherosclerosis is one of the four horsemen of disease. And I have to agree with that, because it is the pillar of many of diseases that we have, strokes, heart attacks, etc. So calcium plays a huge role, and also understanding cholesterol. And like I said, please go watch our lecture on cholesterol, because the calcium and cholesterol, when they work together, that's when they go ahead and clog our arteries, right? Oh, it behooves you to understand LDL, HDL, your good and your bad cholesterols. So when you see osteoporosis, you definitely want to check for heart disease. And when you see heart disease, you definitely want to check for osteoporosis. So how would you check for osteoporosis? So you would use a machine like a DEXA scan, right? We happen to have one in our office. A DEXA scan is basically a pretty much long x-ray. It's a long in time, and it actually goes all through your body longitudinally, and doing an x-ray on your body to see actually what those bones look like. And before you have osteoporosis, you can have osteopenia, right? But if you want to address that, and and I've seen this in women and men in their 20s where their bones are so brittle already, they're in osteopenia or close to osteopenia in their 20s, late 20s, and it's like, what are you doing? And it's a game changer when you have a conversation with the person and you look at their DEXA scan, and it's like, look at this. Look at what your bones look like. And we have one in the office. It's not really to check for bone disease, not at all. We have one in the office to actually check for, we use it for body composition. It's a great way to check for fat and muscle, etc. So I'm a big fan of our DEXA scan. If you go into our social media websites, you'll most likely find videos of me laying on our DEXA scan, because I use it every so often to see my body composition. But I keep eye on my bones, right? So yes, and you can do loading of the bone, etc. By lifting weights, especially if you're older. Very important. I've been lifting weights pretty much since I was 13 years old, 12, 13 years old. So that's helped me a lot, but I also am very proactive as it relates to my supplementation. So the vitamin D3 with the K2, to tell you the truth, you don't really need the calcium, because the vitamin D, like I said, will pull the calcium from the gut, and the vitamin K2 will tell the calcium, hey buddy, get out of these bad places and go to the good places. So once you start to use these principles to mitigate what's going on with your osteoporosis or heart disease, one will help the other. And that's why I'm so big on telling you guys always, balance one part of the body is balancing one part of the body or fixing one thing, to me, is not the way to go. And that's not how we did this, 250 years ago. We looked at the body as a whole. Now we compartmentalize the whole thing. But it all goes together. And once you start to optimize and fix the biochemistry, that's when you actually start to improve the physiology and the psychology of the person, right? So, when I started, like I said, I started talking about micronutrients, and we went into a little bit mental health, just a little bit, but notice how I'm going into other areas as it relates to the physiology, which are so important, like heart and bone health. Now, keep in mind, going back to the vitamin D3 and the vitamin K2, that if you don't also have magnesium, vitamin D3 and K2 also will not be responsive. So it's important you do a high quality magnesium, and pick one depending on what your interests are, more if it's heart health or brain health, which would be, for example, magnesium malate. I do a lot of magnesium malate. Obviously, I want to hold as much information as I can in my brain, be in the best mood that I can, get the most amount of work done. I'm a entrepreneur, with a doctorate degree, and working in the medical field, managing medical businesses, etc. So I want to have my brain, as it relates to what I'm doing, at tip-top shape, right? So I make sure that I take magnesium malate, but important that you have the magnesium, that you have the vitamin D3, the vitamin K2, right? And one that I always like to add to, a little low-hanging fruit, is vitamin C. Vitamin C is super important. And let's talk a little bit about vitamin C. What is the gland that consumes the most amount of vitamin C in the body? It's the adrenal gland. So I did 2 lectures for you guys on fatigue. So go check out those lectures too, right? There's part 1 and part 2. And on part of the lecture on fatigue, I talk about adrenal fatigue. So adrenal fatigue is basically where you've released so much adrenaline, right, which comes from the adrenal gland, and you start to burn out, and your cortisol levels start to go. First, for most part, people will go through the wired and tired phases, and then they'll go through that burnout phase, which the body's barely producing any cortisol. If I mean the body's you cannot not produce any cortisol. That's you know wouldn't be correct to say that, but where you're producing way less cortisol than you should be, and that's called it's called CFS, chronic fatigue syndrome. Okay, so the gland that consumes the most amount of vitamin C is the adrenal gland. So now if you're a businessman, entrepreneur, high stress individual, mom, going through school, and single mom with kids, or mom trying to deal with a big family, dad, whatever it is, a high stress person, right? And remember, there's true stress and there's perceived stress, right? The day you die, if it would be possible to ask you, hey, how much stress was real? How much of the anxiety was real? The answer is probably going to be 95% of it was not. It was made up in my mind. Because remember, your brain does not run on reality. It runs on your perception of your reality. Okay, so keep that in check. But, so I always like to be cautious when I say you're a highly stressed individual, because everybody's like, me, I'm stressed, I'm very stressed, oh my God, I don't know what to do. It's like, no, you're putting yourself through stress, right? Even today, somebody asked me this because we were looking at my Whoop data. Hey, how stressed are you? I'm like, pretty good. So again, not here to talk about stress. Go watch our lecture on fatigue and adrenal fatigue, but I'm here about to talk about micronutrients today. So on the adrenal side, okay, the adrenal gland consumes a ton of vitamin C, but she also consumes a lot of zinc, which is a mineral, and she consumes also a lot of vitamin B5 or pantothenic acid, right? The B vitamins, they have funny names, like B6 is pyridoxine, B5 is pantothenate, B3, niacin, and so on and so forth. They all have thiamine and so forth. They all have very funny names, but B vitamins, right? Vitamin B5, zinc, and vitamin C is actually called the triangle of treatment of the adrenal gland, right? In holistic circles, when you're looking to help the person to get better as it relates to an adrenal fatigue scenario. For example, there's the herb ashwagandha, which has been made very, very popular recently, just because of how it can help somebody that's going through adrenal fatigue or people that want to prevent adrenal fatigue. Ashwagandha is used heavily, which I think is great. But guess what ashwagandha is full of? It's full of vitamin C, B5, and zinc. There's a lot of it there. So, because remember, plants will break down to the micronutrients. What does your body have little plugs and receptors for? It's not for plants. It has plugs and receptors for micronutrients. When you eat your food, etc., it's all breaking down to these micronutrients. So what's important is to understand how much micronutrients your body has and is deficient of. That's why I always suggest people to do a micronutrient study. Because right now, I'm just scratching the surface. I have so much to say in regards to micronutrients, but you might be thinking, oh my goodness, micronutrients are that important? I didn't even talk to you guys about amino acids. I didn't talk to you guys about your fat-soluble vitamins. And just coming to mind, for example, if you don't have a gallbladder, if your gallbladder was removed, do you know you're not absorbing fat-soluble vitamins? Vitamins A, D, E, and K, ADEK. You're not absorbing those, right? And there's protocols where you're put on bioidentical bovine bile daily with every meal to help you absorb those four fat-soluble vitamins. Those are the fat-soluble ones where you'll see that many studies suggest that you can harm yourself if you take too much of it. So, and there's a little bit of variations there. For example, people are very worried about vitamin A, and they talk about retinoic acid and how it could be so harmful for you. But retinoic acid is not per se vitamin A purely. Okay, it's a little different. So if you go to pubchem.com, there's PubMed, right? But you can go to PubChem to verify a lot of what I'm saying and actually understand the differences, for example, between folic acid and folate, which is vitamin B9. It's not the same thing. Okay, so be very weary of actually what you're putting in your body, right? And when you're a little uncertain, and if you really want to roll up your sleeves and get to doing some research, go to PubChem. Okay, PubChem. That's the database to actually understand the molecules and vitamins and so forth. Medications, really, really interesting. So going back, anybody that's having issues with feeling tired and exhausted, etc., should consider some vitamin C. But first, look at the levels inside your body. And again, it's a pretty darn safe vitamin. I've seen people take actually a few grams daily, and they do pretty well. It could cause a little bit of GI distress as well. I'm not suggesting that you take any of these high doses. Remember, talk to your physician if you have questions about this. But it is a good way to mitigate a lot of the adrenal gland issues. Now, will this help you totally? If you're listening to this and this is the first lecture you're listening that I've done, and adrenal fatigue, you might be thinking you might have adrenal fatigue or you want to veer away from it. If that's the case, go listen to the fatigue lectures to really understand the whole picture behind adrenal fatigue, okay? Because it doesn't only relate to vitamins and minerals and micronutrients in general. It also plays a role with your hormones, etc., even what you're eating and mindset, etc. So, and I'm like I said, I could talk days about micronutrients, and I'm going to start wrapping up here with two more. We're going to talk about selenium and we're going to talk about chromium. Chromium is super interesting as it relates to sugar and metabolic issues. So chromium, or let me put in one more, alpha lipoic acid, which is a great antioxidant. It's hard to talk about chromium, not talk about alpha lipoic acid. So alpha lipoic acid and chromium are super, super interesting to help mitigate issues with sugar, right? So somebody that has a high HbA1c, which is basically HbA1c is one of the ways that, or kind of the main way that you diagnose diabetes. You can also diagnose diabetes on two fasting blood sugars, more than 125, right? But most people use HbA1c, which is basically the amount of sugar stuck to the red blood cell over a period of 90 days to 120 days. The red blood cells, she lives 120 days. So it's basically a calculation. How heavy is that red blood cell because it's stuck with sugar? Because sugar tends to be sticky, and so is that red blood cell, and they kind of stick together. And by that, we extrapolate how much sugar is in that person's system, and anything over 6.5 here in the United States is considered diabetes. Anything over 5.7 is considered prediabetes. Anything under 5.7 below is not diabetes. But the lowest HbA1c I believe I've ever seen in my life was maybe a 4.2 or 4.1. I've never seen anything in the threes, so don't try to say, oh man, let me get to a 2. No. I, for one, don't do very well with an HbA1c. I've had my HbA1c low, very, very low. I always actually have it kind of low, around the 5. But if I go into like close to 4.5, I feel terrible, very low sugar, etc. That's another conversation. But just because of my body composition, I'm 5'8", 200 pounds. I just did my DEXA scan, and I have about 162 pounds of muscle and 38 pounds or 30, what was it, 36 pounds, something like that, of fat. So it's easier for me with that muscle to height ratio when I work out, etc., to pull sugar into my muscles. And I've trained my body with that by certain peptides I've taken, like MOTS-C, IGF-1, etc., and also by certain supplements that I've taken, like alpha lipoic acid and chromium, which help to really reduce sugar. Basically teaches your body to pull sugar into the muscle versus it going into other nefarious metabolic pathways. So for that, we upregulate the receptor of sugar in the muscle called GLUT4. But anyways, don't want to go too much on a tangent there, but on the micronutrients, a good way to pull down those sugars is using alpha lipoic acid, using chromium. It's nature's metformin, if you will. And if you don't know what metformin is, it's a very popular diabetes medication, which I'm not too fond of, especially in the anti-aging community. They like metformin, but again, I'm not too fond of metformin. When we talk about that at another point in time. Now, selenium, wonderful. So, for example, vitamin E and selenium, and there I threw in another one. I said we'd only talk about two more. I threw in alpha lipoic acid, that makes three. Now I'm throwing in vitamin E, so that makes four, and I'm going to wrap it up here for today. So, selenium and vitamin E, very, very cool, very amazing micronutrients. Vitamin E being also considered an antioxidant, but it's also part of the lipid-soluble vitamins. ADEK, remember A, D, E, and K, ADEK. It's a good way to memorize it. It's one of the ones that I told you you will not absorb it or absorb it minimally if you don't have a gallbladder. So, vitamin E and selenium, your thyroid loves it. Your thyroid runs on a lot of selenium and vitamin E, and also on iodine. Go watch our other lecture on environmental toxins, where we talk about toxic halides, fluoride, bromide, and how they displace iodine from your thyroid. So, and chloride. So fluoride, bromide, chloride. So I was actually mixing up the names. It was a chromium chloride. I was mixing it up for a second. So normal when end of the day and you're doing your recordings, right? So and just want to tell you guys, this is a commitment I've made. This is a commitment I've made to do one of these, one lecture per week. So whatever you're committing to, is it going to the gym, whatever it is, make sure you do these, in my case, these lectures, but make sure you do whatever you're committed to. So really, really important, okay? I'm just giving you guys an example of something I'm committing to. I'm committed to doing 100 lectures right now. So this is lecture number 9, just for the record. So our soil nowadays doesn't have chromium, doesn't have selenium, and obviously I'm speaking in absolutes here, but it has very little. So our soil carries and harbors a bunch of vitamins, especially minerals, right? That's why Soleil water, I don't know if you've heard of Soleil water, is so important. Soleil water is that pink Himalayan salt water that you make at home, right? And it has about 60 minerals in there. That's God's Gatorade for you, okay? But now our soil is so void of certain minerals, right? So you take grandma's crooked tomato, okay, before 1970s. And why before 1970s? Because we've had 2 agricultural revolutions. Our first one was in 1970 with the pesticides. Our second one was with the GMOs, right, in about the year 2000. So you take grandma's crooked tomato and you'll see that that tomato had more selenium than, you know, your most expensive tomato that you can buy at your local fancy schmancy supermarket, right? And the point is, because our earth is void of nutrients and vitamins and so forth, it's affecting us. It affects our health. Then you go to your regular doctor, and your regular doctor tells you, hey man, you're having an issue with your thyroid. You have hypothyroidism, you have whatever it may be, and all of a sudden puts you now on a medication lifelong, a chemical intervention. And now we're starting to see, and we're able to render calculations where, yeah, that medicine, of course, if you have hypothyroidism, you're going to feel terrible, right? If you have Hashimoto's, for example, which is a different story, whether you're most likely going to have anti-TPO antibodies, that's a different story, right? There you actually have antibodies. You're having an autoimmune disease, and you can go listen to our lecture on autoimmune diseases. That's a whole different story. Not that that thyroid would not potentially benefit from vitamin E and selenium and from the iodine, but the thing is, our earth doesn't have those minerals, and then it starts to affect us, okay? And this is something that's not going to get any better, all right? So I'm going to wrap it up today with these thoughts on micronutrients. I'm going to go a lot deeper. This is going to be a few series, probably a few lectures, just because there's so much to say in regards to micronutrients. But micronutrients are super, super important for your health. I don't care if you're a 189-year-old person, and if you are, I'd love to meet you, or if you're a 20-year-old athlete, or whatever phase, area of your life that you're in, if you're in a peak performance phase, or if you're just trying to get by, micronutrients are super important. And here's a very strong suggestion. I suggest that you guys go get yourselves a micronutrient panel. Go get yourself a micronutrient study. It has so much to do with your skin health, hair health, mental health, physical health. You are made out of micronutrients, okay? Your mitochondria run on micronutrients. Your brain runs on micronutrients, and I mentioned just a few things about these micronutrients, and I could keep talking, like I mentioned to you on alpha lipoic acid, and it has to do a lot with multiple sclerosis, and it helps, for example, in the myelin sheath in cases where multiple sclerosis, etc. There's so much to talk about these micronutrients. Why? Because you're made out of them. You're not made out of medications. You're made out of micronutrients. Have a good night. Love you all. Dr. D.